Hello, everybody, and welcome to the next webinar in our 2024 webinar series on self-care, a very important topic to everybody. My name is Andrew Spiegel, and I am the current board chair of the World Patients Alliance, and great to see everybody again. Next slide, please. So we do have instant AI-powered translation, interpretation through Wordly. And Hussein, do you want to run through this real quick?
Yeah, so it's very easy. In the chat box, you will find the link. You just have to click on the link, and a window will open. So you just have to select the language in which you want to listen. So like Spanish, you can select Spanish, put your name, and then just click attend. And another window will open, and you just need to switch off this mic here on the right hand side. Sorry, a speaker. So once you click on this speaker, you will hear everything in your own language. So put your name in the first window, your language, click attend, and on the second window, just click on the speaker and you will listen in the language that you have selected. Yes, over, Penny, Andy.
Great, great. Okay, next slide. So just a couple of words about us. The World Patients Alliance is a NGO umbrella organization of patient organizations, patients, and stakeholders from around the world. And we work to make sure that the patients are in the center of all healthcare policies and that they have an active role, including the planning, provision, monitoring, evaluation, research of health. All of our members don't pay a fee to be a member. So if you are an NGO, please look at our website at worldpatientsalliance.org and see how to become a member. It's not difficult. Next slide. So we currently have almost 500 patient organizations, and there's about a dozen pending applications. So we are knocking on the door of representing 500 patient organizations from 124 countries. And you can see that they are very geographically diversified, from 132 in Europe, 114 in the Americas, 116 in Africa, 100 in Asia, and 14 in Oceania. Next slide. So today we're going to talk a little bit about self-care. First, we're going to talk about an introduction to self-care and the WHO self-care implementation framework. And then we're going to talk about the patient's role and responsibilities in self-care. And then we'll have a panel discussion. And then Hussein will take over and moderate a wrap-up session and questions. So that's what we have on the agenda. Next slide. So self-care, I believe we're going to play a video first. So why don't we go forward?
Ensuring the right to health for all requires a fundamental transformation in our health systems. The World Health Organization recommends self-care interventions for every country and economic setting as a critical path to primary health care and as a way to reach universal health coverage.
Devices, digital health, drugs, and diagnostics continue to evolve so rapidly that people have new ways of accessing their healthcare.
I look at self-care as a revolutionary approach, especially that it brings the sense of taking services closer to the community.
Self-care does not replace the healthcare system. Self-care complements the healthcare system by providing a set of tools that empower individuals, families, and communities to promote health, prevent disease, and manage illnesses with or without the support of health and care workers.
There is now a shift in the way we are beginning to manage health.
Self-care shifts the focus away from a responsive approach towards a more integrated approach, which strengthens links between primary healthcare and communities and considers the holistic needs of a person. Self-care supports key principles of human rights and gender equality. WHO's 2022 revised guidelines on self-care interventions for health and well-being address different areas that empower individuals to promote, maintain, and manage their own health and well-being in a safe and supportive environment.
Là, le self-care est arrivé. Pour nous, franchement, et les travailleurs dans le terrain, c'est une bouffée d'oxygène. C'est-à-dire qu'on va répondre aux besoins spécifiques de cette population.
The COVID-19 pandemic, climate change, and conflicts that have put increasing numbers of people in fragile and humanitarian settings have further accentuated the need for self-care options.
We need to provide people-centered care that acknowledges the resilience and ability of people to self-care.
And as much as communicating with the community is concerned, we use the language they can understand. And then we try and have a face they can relate with, as opposed to the white jacket and scrubs.
When there are effective integrated health systems and supportive legal frameworks, self-care can offer new possibilities.
There is an implicit assumption that the major form of healthcare is medical care. But in fact, self-care is the first line of response for all healthcare.
Achieving health for all includes empowering and educating people to become active decision makers in their own health. That's what self-care is all about.
Self-care can pave the way towards universal health coverage and a world where everyone is able to realize their right to health.
Great. Well, that was a great introduction by the WHO to what self-care is. I think we're going to have a little change in the speaker lineup, and we're going to start off with Judy today, I believe. Is that right?
Yep.
Judy Stenmark? All right, Judy. So we're going to get your slides up there because one of the speakers is a little delayed at the airport. So you're going to go first, I believe. And you have been leading the Global Self-Care Federation since September of 2018. And you have overseen a restructure and rebranding of the organization, implementing a new and future of self-care strategy. You have a background in health with a degree and a master's in public health. And you've been a longstanding leader in the global and national musculoskeletal arena. And much more about you, but let's not take the whole webinar to introduce you. Let's hear from you, Judy.
Thanks so much, Andrew. When I sent that bio, I wasn't expecting it to be read out.
I hate when they do that too.
Thanks so much, and good afternoon, good evening, good morning, everyone. Next slide, please. I'm delighted to be here this afternoon to speak to you all. Just very quickly about Global Self-Care Federation, established in 1970, initially as the world self-medication industry. And then we changed and rebranded actually to focus on self-care about 6 years ago. And our big focus is trying to see self-care embedded in global policy around the world. We've been a non-state actor with WHO since 1977, in fact. Next slide. So since I'm going first now, I will talk about the definition of self-care because this is the WHO definition, which I think is a really good one about the ability of individuals, families, and communities to promote health, prevent disease, maintain health, and cope with illness and disability with or without the support of a health worker. And the scope of self-care includes health promotion, disease prevention and control, self-medication, giving care to dependent people, and so on, looking after the family, basically. But really what we would like to see, and I think you might all agree, is that we want people to be active self-managers of their health. And that's what self-care is all about. So self-management might involve self-medication, especially for minor illnesses, self-treatment, self-examination, self-injection, self-administration, and also self-use. Next slide, please. So just really the person, the individual, the patient, whatever you want to call them, they're at the center of the continuum of self-care. And that also involves the community, families, but also health workers at various times. in particular, the pharmacist, nurses, of course, as well as doctors at different times. So self-care and UHC, self-care embedded appropriately and properly will help to drive UHC. And as we know, that is a driving ambition of WHO and many people around the world. Next slide, please. So what Hussein asked me to do was actually talk about our economic and social value of self-care study and our self-care readiness index, two major reports we did in the last few years. I'll just touch on them briefly, that we've done in collaboration with WHO, in fact, as part of our collaboration plan. And what we realized, especially about 6 years ago, was that, you know, we all say, oh, self-care is good. That's great. But we didn't really have much evidence to say, well, actually, this is what self-care does. So we've worked hard to try and demonstrate the real value of self-care. So the first one is the global social and economic value of self-care, which was a global study. Next slide, please. And this was really a landmark study because we really tried to quantify not only that, listen, this will save dollars for everyone, for people, for doctors, for nurses, and for systems around the world, and make a big difference in quality of life. Next slide, please. So this is, it looks complicated, but it's not really. So what we did was we looked at what's the current savings, cost containment, time savings, etc., right now where self-care is concerned. And we looked at various aspects. And what's it look like in the future by 2030, for example, if we're actually putting more self-care in place? There are more products available. There are more things available to help people self-care appropriately. Health literacy is enhanced. So this is what we looked at. And astoundingly, the cost savings generally to health systems right now are about $119 billion per year. And by 2030, if we continue and enhance self-care, availability of self-care products, as I said, and other items associated, it could go to almost 180 billion. But it's not just about health systems. Now, we all know health systems around the world are, like, in some places in pretty poor states. So we need to look at other options, but it's not just health systems. It's also to us, the individuals, the patient, as well, saving time by not going to the doctor, not traveling to a doctor, not taking a whole morning, as well, not taking time off work to self-manage, as I said, very often minor illnesses, things like that. Physician time saving, huge. So the 1.8 billion right now. So that means that then they can focus on the acute cases that really need their help. And let's say you're a person and your osteoarthritis in your hips is really, you know, you're not doing well this week, then maybe you don't have to travel and go and see your GP or physician. Maybe you could look at what you should do with the family, or maybe you know it's about exercise. It may be about over-the-counter medications, or it may be a chat with the pharmacist or the physiotherapist about exercise as well. So productivity days generally, about 40 billion in savings, welfare costs, and then quality of life. And there's certain algorithms used to calculate qualities or quality of life, but approximately 22 million in savings right now in terms of quality of life. So I'm happy to send further information to people after this with an executive summary of that whole report. Next slide, please. So our self-care readiness index that we did with WHO, we've done phase 1 and phase 2, and we've looked at around 20 countries right now. So what we looked at were what are the enabling environments, the ideal enabling environments for self-care around the world that will foster self-care, ranging from the regulatory environment for products, for example, to health literacy levels. And while we didn't really compare like-minded countries or similar countries in different regions, we did give people, scores, if you like, for how well they were doing or where there could be improvement. Next slide, please. Excuse me. So you could keep pressing. Yep, another one. Great, thank you. So there were lots of interesting thoughts and data that came out of that. But what's needed? We need an increase in the quality and quantity of self-care information available to consumers. And of course, that's all about enhancing health literacy. We need self-care embedded in policies around the world. We need standalone self-care strategies. And we need people to also agree on the concept of self-care, because people around the world have very different views on what self-care is. And while a bubble bath at night after a hard day might be something that's really nice to do, that's not what we're talking about really when we talk about self-care. And we need a broader alliance of advocates all working towards the one goal of healthier populations, better quality of life. And that's why we believe the adoption of a self-care resolution by WHO in 2025 would be something that could bring all these things together. Next slide, please. Next one. Okay, so again, this looks like a bit of a crazy slide. It looks better when it's printed out. But again, just showing some cost savings in various areas. In Latin America, for example, right now, 3 billion is used in the treatment of non-serious contributions by public health systems. So again, if more self-care was implemented, then think of the potential savings there. And I think we can see that COVID really shone a spotlight on self-care. In many ways, it shone a positive spotlight, if you like, because people realized, okay, I don't have to go to the doctor. I can either talk online or I can get the information and I can take steps to implement self-management strategies myself. So we think that it's a changing landscape, of course, but the post-COVID landscape is that self-care is a core component and we'd better take it up, that we need to integrate it into the healthcare continuum, and that it's relevant in the pursuit of UHC in terms of especially the prevention and management of NCDs. Next slide, please. So I just wanted to touch briefly on a WHO resolution on self-care. We formed the United for Self-Care Coalition about 15 months ago, and that's a group of global health-related NGOs. WPA joined last year, which was great. And we meet regularly to look at how can we work towards a resolution. Next slide. Because what we really believe is we will not see significant policy change without some sort of WHO resolution. Now, what would it call on member states to do? To recognize self-care as critical and a key component in the continuum, that we would call on member states to invest in policies that promote self-care practices and create the opportunities for people to engage in self-care. Enhance public health literacy, and a term we're using now is self-care literacy. And I'm sure that Christine might bring that up later in the panel discussion. We need to adopt, integrate and scale digital health tools. And again, this could include things that would enhance literacy, and build health and social care professionals' capacity on self-care, increasing their awareness as well, and provide training. Next slide, please. So this was, again, WPA is a signatory to this. At the end of last year, we had the São Paulo Declaration, where we were at our regional meeting there, and we were able to have at least 8 countries from Latin America signatories to this important declaration that we can use in our advocacy efforts going forward. And really what the main areas that we called action on, commitments to, were promoting self-care for primary healthcare and UHC, supporting self-education and awareness, i.e. health literacy, leveraging technology, strengthening collaboration and partnerships, and that's critical. And that's why it's great to see so many people online listening to this, so many people from different WPA groups around the world, I'm sure. Equity and inclusivity, so important. And again, health literacy is key in those two areas, advocating for better self-governance and about monitoring and progress as well. Next slide. So I wanted to just finish off with this because I thought I should definitely mention self-care literacy. And there are some people that would say, and you can see on the bottom, that there is no self-care without health literacy. And certainly we couldn't have this webinar without mentioning it, because it is a key enabler of self-care. It is really foundational, and it helps address health equity and inequality, which is so important. And just look at the last point there, the cost of the impact of poor health literacy. And it can be as much as, 7,000 or almost 8,000 per person, per patient, per year in terms of the estimated costs when people aren't self-care literate. Okay, next slide, please. That could be my last. So, look, I've tried to give you a little overview of GSCF and some important things we're working on, and also about our resolution work and finishing on literacy. Thank you so much.
Well, thank you for that great presentation, and I loved all the data that you bring forward to prove how important self-care is. Next up, we have Penny Cohen, who is a co-founder and board member of the World Patients Alliance. She's also spent decades in the pain space and was the founder and CEO of the American Chronic Pain Association for decades. Without further ado, I'll turn things over to Penny.
Next slide, please. All right, good morning. And I'm going to talk about the patient's role and responsibilities in self-care. Next slide, please. So a little bit about my own health journey. I've lived with chronic pain for more than 50 years now. And one of the things that's important is to learn how to live with any kind of pain or healthcare condition. So one of the things that I did is I had this journey for 6 years looking for help, looking to the healthcare providers to fix me. And it wasn't until I was referred to the Cleveland Clinic at a pain management program that they actually taught me how to live with my pain, so that I could then do a lot of self-care and not look to the healthcare community. So I began the American Chronic Pain Association so I could not only help maintain my own wellness, but share what I had learned with other people. So over the last 40 plus years, I've worked on providing peer support globally, educating, writing books around self-care, developing a number of graphical tools to help bridge that gap of communication between the healthcare provider and the person living with pain. Next slide, please. So the question is, what is self-care? And I always looked at that as moving from that passive patient to an active participant in your healthcare. And what that means is, for so many of us, we look to our healthcare providers to just fix us, whatever it is, to give us all the answers. We don't think we share any of that responsibility in our healthcare, when in fact, we really are a part of the healthcare team. Next slide, please. So when we're building our healthcare team, and it's not just about your healthcare provider, it's about the nurses that you're going to encounter, the physical therapist, the pharmacist, the psychologist, maybe a dietitian around nutrition. Also, your caregivers are part of your healthcare team. But at the center of that healthcare team, that is the individual who is looking to the healthcare team for help. In other words, it's the patient. So one of the things that's really important to make sure that you have a team and that they're all communicating and they're agreeing on a healthcare plan, so that we're not doing different things. And that allows us then, when you talk to any of your healthcare providers, they're going to give you the accurate information so you can make an informed decision because the decision's not just up to your healthcare provider, but you share in that decision. So they're calling it shared decision making, and that's really important for us to have that ability to take part in our healthcare and be part of the healthcare team. One of the things, next slide, please. So some of the responsibilities of healthcare providers, and I think the first one is for us to be able to understand our diagnosis. And quite often, healthcare providers tend to speak in terms we don't understand. So I think it's important for you to know that you are allowed to ask questions. And if you don't understand what they're saying, please ask. And that goes into health literacy, is that we're not healthcare providers. We're not trained. We don't know what all that information is. We need to be able to understand so that we can make those informed decisions. They also have to manage our medication, and that's an important one, that they're all on the same page, because a lot of times one provider may provide one thing, and unless they start interacting with each other and talking, the other one may provide a different medication, and there may get what they call a drug-drug interaction, which could be dangerous. That they document all your health records so that no matter who you're meeting with, it's all down there in your health records, so that everybody knows exactly what you've gone through, what the tests are, what the treatments are, to help you recognize what early signs are, for them to educate you on your condition, disease, and then to give those guidelines for physical activity based on your ability and your conditions, not on general what people with your condition have, because we're all different. And just because we may have one healthcare problem, that doesn't mean that we just have one healthcare problem. We're very complicated. Some people have a multiple or a number of different healthcare issues, so they really need to better understand what's best for that individual. It's all about individualized care. And then self-management techniques, and for them to teach you. And one of the things that I always found interesting is at the end of every meeting, when there was nothing else they could do for me, they'd look at me and tell me to learn to live with it. Well, that's fine and dandy, but I don't know how to do that. I didn't know how to do that. You can't tell me to learn to live with it. You have to teach me how to do that. And we'll talk about that in just a minute. Next slide, please. So looking at the responsibilities of that person, that patient. And I think the first thing is that we need to prepare for our visits. We can't just go in there and expect them to give us all the information we need. We need to be able to share what we know and what we've been doing in between visits. It could be a week, it could be 3 months, it could be 6 months. They don't know what's going on, so we need to be able to tell them. And too often we assume if they look at us, they're going to know, or if they just look at the blood test. You can't tell by looking at somebody what's going on. So it's our responsibilities to tell them how things are. And it's important to let them know, medications that you're taking, if they're helping, if they're not. Have anything changed in your health conditions since the last time? Most importantly, what's improved since your last time? And it's also important when you do this whole thing and have these visits to take someone with you, because a lot of times, what we're saying and what we're hearing from our healthcare provider, we don't hear. We hear through our emotions. And sometimes what we think we hear may not be exactly what they're saying. So that's also very important. You need to be very honest with your healthcare team. Like I said, they can't tell unless you tell them. So it's important for you, and it's important to write down all your questions, anything before you go to your healthcare provider, so that you make sure you cover all those things. Because once you walk out that door, it may be very difficult to be able to have another conversation with them until your next meeting. So it's important to be very open and honest and share all the information, and be prepared for that visit when you go. Also, you need to be supportive. That means both of, and we're now talking about the patient, but also the caregiver. And a lot of people don't realize how much the caregiver, how much they are actually emotionally involved in all of this. Years ago, I did a survey. It took me 3 years to talk to caregivers, because I don't know what it's like to live with someone with pain. I only know what it's like to live with pain. And I was really surprised because I thought I was talking to people living with pain. There was only one difference. They didn't feel the physical pain, but they shared all the same emotions, the fear, the anger, the guilt, the frustration, the confusion. So I think it's really important for us to understand that those people caring for us need the same kind of support and understanding. And again, it's that communication between the two that's really going to be helpful. To stay informed about your condition, obviously ask your healthcare provider to provide you with that information, but a lot of people these days are going to the internet, and you have to be very cautious when you do that, because while there's some really excellent sites, there's a lot of healthcare sites from institutions, healthcare facilities, some government agencies, WHO, places like that. There's a lot of bad information out there, and people tend to believe what they read. So it's really important to stay informed. And if you get that information, discuss it with your healthcare provider so you make sure that you have the accurate information. And then, of course, always make sure that you're a part of that decision making when it comes to your healthcare. Next slide, please. So some of the things that we talk about when it comes to self-care is to master your time. And a lot of things like, for me, it was, one of the big things for me was I had to keep exercising and I had to do my stretches every day. If not, things were going to start to fall apart and I could fall back into that patient role. And that was something I absolutely never wanted to do. I made that commitment to myself. I was going to remain a healthy person in spite of the pain. And because I learned how to live with it, I could do that. And so exercise is not my favorite thing. I don't know about you guys. So I always did it first thing in the morning. I got it out of the way, but I always did it. And part of exercising, what's really kind of important, is sometimes you can also look at the family, because sometimes it's easier to do it with them or to join a club or something, but have those routines. If you're taking medication, set an alarm, just make sure, on your clock or at your whatever, so that you remember to take it. That's also important. Setting realistic goals for yourself. One of the things about our any of our health is that we tend to have good days and bad days. And the problem with the good days is we try to do more than we should, because we figure, all right, we're going to show what our value is. So we do a lot more, and we don't narrow down our goals to small, manageable steps that are within our ability, not from what we used to be able to do, but what we can do today. So if you have a good day, don't push to the very end. Enjoy that day, because you may have a better day again the next day. If you push and you overstep your limits, you might really have a bad day, and that fear of increasing, the pain, the discomfort, it'll just carry through, and you won't ever do that again. So we have to listen to our body, and when they say ouch or when they say enough, stop. That's what you have to do. You have to embrace your ability and your your ability to listen to your body. You have to have regular checkups and make sure you always go to those checkups. You have to have a sense of, learning and continuing to understand the condition. Things change. I mean, medicine is always evolving. But most importantly, you need a support network. That means your caregiver. But what I found is that sometimes it's the people who are sharing your same exact experience, whether it's living with pain, diabetes, heart conditions, some kind of skin disease, that we need to be able to talk to our peers. And so it is that peer support that's going to help you continue to understand and to feel like you're not alone. Because a lot of times, people will look at us and say, oh, you look so good. They can't see what's going on inside of us, and we can put up a good front a lot of times. So it's important to be able to talk to other people, to share those emotions, not talk about how terrible you're feeling, but actually share your emotions and share the things that you're struggling with, because someone else may have a really good idea about how to help you get through that day, if it's even if it's just cooking a meal or taking care of your child, or how to pace yourself. I mean, there's so many things, good things that come out. I can always remember when I was in the pain program that the healthcare team would say sometimes the people, and it was a group of people that we had, they'd say that we could help each other more than they can, because we understand, we've walked. So that's really important. Next slide, please. So maintaining your wellness, and that's really where I think I've been at for the last, so I went through the pain program in 46 years ago. So it's been my job to maintain my wellness. And so that's something that I have been able to do, continuing to learn, continuing to do everything they taught me. I've incorporated it into my daily living. And, my stress management. I mean, people don't realize how much our emotions impact our health. So that's really an important thing to understand, recognize emotions, understand them, to keep those exercise programs going. One of the things very few people talk about are things like your basic rights, which I always impressed upon people, because we have the right, to be taken seriously, to be listened to, not to be doubted about what we say to our healthcare provider, to ask questions, to get the respect that we deserve. There's a number of basic rights that we could talk about maybe at another time. To follow up on the healthcare visits, to continue with your diet. And that's something that can be really hard, especially when your family may be eating something else. But continue with your diet, your exercise programs, that stress management. Again, listen to your body and know what you have to do. And maybe a bubble bath will help you, as they said. It might make you feel good. That may be part of how you unwind at night before you go to bed to improve your sleep. Who knows? And always take your medication as prescribed. If you're adding any supplements or over-the-counters, make sure that you tell your pharmacist, and it's always important, if you can, to go to one pharmacy, because they're going to keep records of all of your prescription drugs, so there's not going to be that drug-drug interaction, just in case. And most critically, appreciate your caregivers, keep open communication with them, but most importantly, look for that peer support. And there are peer support. I mean, that's what WPA is, and a lot of the organizations that are our members, they provide that kind of support, education, and encouragement. So I think that's it. And thank you for listening, and enjoy your day. Thank you.
Thank you, Penny. Another fabulous presentation. Next up, we have Manuela Narasimha from the WHO. Let's get those slides up and see if we could get, let's see here. I know she's at an airport, I believe, so there could be
I'm here. I'm online.
Oh, great.
You can hear me. Yes. Hi. Yes, I am at the airport, but yes, yes.
Okay, give us 1 second for the slides to catch up to you.
No problem. I'll just introduce myself. So my name is Manjula Narasimhan. I work in the Department of Sexual and Reproductive Health at WHO. And it's always a difficult act to follow with Penny and others who've presented before. So thank you for setting the scene so well. I think it's the reality of what's on the ground is where we really need to focus and respond to what the patients and the people themselves are saying. So my presentation is a slightly more dry, I must say. It's about the guideline from WHO, the guidance that currently WHO has around self-care and self-care interventions for health and well-being. And from the get-go, I just wanted to say that the focus here are really clients of health services, not so much patients. Of course, some of those clients would be patients, but it's really takes on a broader approach. So just to start off with that, and we really wanted to look at what it means to address the needs and health and the rights of people, putting them at the center of the health system. So these are really, when we talk about self-care interventions, what we are really focusing on are those interventions that could be seen as in transition from what could be provided at a health service through an over-the-counter or the pharmacy to what can people themselves be using and accessing and understanding. So next slide, please. So that's why, I just started off with the terminology. The next slide, please, is the way we are looking at self-care is really the ability of the individuals, the families, and communities in conducting a range of activities that are about promoting their health, maintaining their health, preventing any ill health, and coping, as as Penny was just talking about, in terms of coping with illness or a disability. And this can be, at times with the support of health facility, health worker, but it can be done also, on their own, or in the context of the safe space. The next slide, please. And what we mean by self-care interventions, and we try to nuance this because self-care can be a very broad term that that covers anything from having bubble baths, as was just mentioned, or eating chocolates, or any other activities that that people may feel is important for them, and a sort of a larger range of activities and behaviors. But we focused in this guideline from WHO on self-care intervention. So really the tools that can support self-care. And we're aware that, this may be used differently or understood differently within different health contexts. So for instance, for a diagnostic product like from COVID, people would be, COVID self-testing, HIV self-testing, pregnancy self-testing. So we're using that under the umbrella of self-care, but also other areas such as self-awareness or education, taking a self-sample and sending it to a lab, doing self-administered injections for diabetes or for contraception. And so the term self-care, we're really encompassing a large body of activities that people can do. And we're really looking at interventions, as I mentioned, that are in transition from what could be given at a facility to what people can do on their own. Next slide, please. And in terms of understanding this from a health system perspective, the classification around self-care is really to try and get that simplified language that everyone can adhere to. And it's really about how we can address a health need from either the individual or a health system perspective, and how self-care interventions can address that. So next slide, please. The way this document, so if we look at it at a specific challenge, we can, we have a range of interventions that can address that at a health system or at an individual level. We acknowledge that more and more people get information, products, services, counseling, in places other than just a health facility. So they do it with their peers. They can do it, particularly through pharmacies, which are playing more and more of an important role in providing this, but also through traditional medicine, through digital means, and others. And the goal of this is really about improving health and well-being outcomes. And we can see through this document how these steps can be taken. Next slide, please. And it includes, and I'm not going to go into it in great detail, but the document includes specific actions that health workers, program managers, policymakers, regulators can take, but also those who are self-caring for themselves and caregivers. Next slide, please. And this is just one example. So in places where there's an insufficient number of health facilities, for instance, there's a lack of availability of the kind of services that a person might need, a patient might need. What could be some of the steps that a self-care intervention can provide, including, as I mentioned earlier, self-testing. And, this could be given, for instance, over the counter through pharmacies that I also just mentioned. And it is really about increased accessibility, increased coverage, improved access to quality products and interventions that meet the needs of individuals and communities. Next slide, please. I think I'll go through this really quickly because this is just to make the point that the guideline development was really informed by end user needs. It was informed by a range of key stakeholders. Next slide, please. And that included So just to say, this is what we call a living guideline. This it includes recommendations that already exist, but also add new recommendations as new evidence comes on board. This will just continue to grow and hopefully be useful for a range of health issues, from mental health, from NCDs, from sexual health, reproductive health, infectious disease control. Next slide, please. And the target audience of these evidence-based guidelines are really for national policymakers, international policymakers, those who are in positions of making decisions about health and healthcare. But it's also about the secondary target audience, which is about product developers. We have included issues such as environmental considerations. So how do we dispose of a self-care product? Like the single-use plastics, and how do we what can we do to make this a better, not just for the individuals, the families, the communities, but also the environment in which they live in. Next slide, please. And as I mentioned earlier, this was really a result of a vast consultative process with an inclusive process that included many patient and community-led initiatives. And this was really important so that the evidence that we're seeing from published literature also aligns with what people themselves are experiencing and what they need. Next slide, please. And so just there, some of the outcomes of that have been also published in terms of the meaningful engagement of those end users in this process. Next slide, please. There are also feedback related to ethical, the legal, human rights, gender, accountability, economic, financial considerations that we need to take on board when we say we are promoting or introducing a self-care intervention. And some of these meeting reports are listed here, but also how important it is to consider self-care options when in the context of sort of financial or areas where people are not able to, they don't have the money, they are in a refugee setting, they are in migrants, they are displaced. It's in those contexts, what does self-care mean? And how can we ensure that equitable, sustainable access to these products are made available for those who might need them? Next slide, please. And maybe I'll just say a little bit more here. We published the Self-Care Competency Framework, and this is a set of 3 documents outlining standards of care for people, but also the training modules for health workers that might be helpful. And so some of the standards, we have 10 standards. Some of the standards are promoting self-care, by individuals themselves, providing people-centered support for self-care, taking an adaptive, collaborative approach for decision-making with the patients, with the individuals who come to seek healthcare, communicating effectively, and I think this was mentioned, with effectively and respectfully, collaborating with other health workers in terms of finding, and community workers in terms of finding what is the best care that the person might need, and promoting the trust, the agency, collaboration with individuals and caregivers, supporting evidence-based care and self-care practices, and really demonstrating high standards of ethical conduct. So that includes for the health workers to have reflective learning and practices about self-care for themselves and how they can do better, and in terms of managing their own health and well-being. And so implementation of these self-care interventions by health and care workers, it really should be based on these sort of values and these competency standards. And we are hoping that these could be implemented and support the kind of behaviors that would need to be associated with each of these standards, and provide better health and care for the end user. So just as an example, if one of the standards is about supporting the individual or their caregiver or their family to access and continue a self-care option, at a community health worker, this may mean about demonstrating this behavior by assessing the challenges, the constraints, the enabling factors that the person might face. And, if it's a nurse at a clinic, what could it be? This could be they're individualizing their advice on self-care, considering the barriers that the person might face. They might also take into consideration the medical and the personal context. And if it's a health service manager, for instance, they could assess the clinic's structural barriers. If it's a person living with a disability, can they access the healthcare they need? And so, addressing, for instance, failures in continuity of supply of some commodities that they might have, and or the limited expertise or the experience among some of the health workers for any particular procedure. So we have tried to address many of these issues within these documents, and they will hopefully be rolled out in a number of settings globally. Next slide, please. Next slide. And the self-care framework that we use, again, as I mentioned at the beginning, is about putting the people at the center of the process. And it is about not focusing on their disease, but focusing rather on their health and well-being. But this can only be done in the context of some key principles about looking at a holistic approach to their health, not taking, piecemealing what might be needed or looking at a low-hanging fruit, but really looking at their overall health and well-being, addressing a rights-based approach, looking at gender issues, making sure there's ethical considerations are taken into account, and looking at their needs across their life course. They might need different, people dip in and out of healthcare, and or sometimes need a longer time at the healthcare, but what might they need at different stages of their life, and what could be sometimes seen as a cumulative effect of their actions across many years or decades. And as I already mentioned, we acknowledge that people are accessing information services in places other than only just a health facility. But in order for individuals to be able to really, understand and use a product, uptake a product, be retained within a service or the use of the product that they might need, they do need a safe, supportive, enabling environment. And that could be having the commodities they need. It could be making sure that they are protected from violence or coercion or stigma or discrimination, that they have access to justice if they need it. They have access to education and the correct information, that they have health and digital literacy to be able to understand what the process that they're navigating. So these are just some of the aspects of that enabling environment. But we want to make absolutely clear that the accountability of the health sector remains. So yes, the individual has an accountability, donors, the private sector, but the health sector accountability is really important. That it's not just about giving them a self-care option and then saying, it's on you now. That should they need to come back to a health facility, should they need to continue to have the healthcare within a facility, then that should be made available to them. Next slide, please. I think I'm just wrapping up here. I think we can, next slide. The guideline actually covers a range of interventions. So antenatal care, and there's just some of the recommendations here from reproductive health and sexual health, but the guideline also covers interventions for NCDs and infectious disease control. Next slide, please. And next slide. So we have a communication toolkit with a lot of the evidence-based guidance from WHO, which we're happy to share. Next slide. And also impact stories from various parts of the world in how these interventions have been rolled out and how they have been impactful at a patient level, at the client level, whether it's in a refugee camp, whether it's through telemedicine, whether it's providing kits to in primary healthcare settings. And it really shows the ubiquitous nature of self-care, how it's relevant in so many contexts and among so many communities. Next slide, please. And I think we can skip this, but just to say that there's a way of monitoring and evaluating how well some of these interventions have been rolled out. And we have we do have an M&E plan to do that. Thank you so much. And thank you for your flexibility while I navigate the airport. Thanks.
No, thank you very much, Manjula, for your enlightening presentation and highlighting the good work that WHO is doing on a very important topic. We are just nearly near time, so we'll just have a very short panel discussion. And I, along with our speakers, I will also invite and welcome our two other panelists, and they are Catherine Dugan, and she is the CEO of International Pharmaceutical Federation, as well as Christine Sorensen from Global Health Literacy Academy. So let me start with you, Christine, or Catherine first. Catherine, are you there? Is your mic
I'm here.
working? Yeah, all right, good, thank you. So Catherine, how can self-care contribute to more sustainable health system and therefore to the achievement of the universal health coverage?
Well, I must just say a huge thanks to the great speakers you've had today. I think there's an awful lot that they've said that really answers that question. But really, and I count all of us in this as well. So this is about being authentic leaders in this space, to support individuals to take greater responsibility for their own health at every stage and at every point of their own personal life and their own professional journey, so they can live a healthier life. This reduces the pressure on healthcare systems, the health expenditure within those systems, the releasing funding and resources, including with our increasingly frail and limited or health worker shortages that we see across all our countries for those with greater needs. And I think it provides us with a bit of a pyramid. So at points, like Penny mentioned, she can access full healthcare whilst being totally empowered to continue with self-care at interim points. And this is really important. And I think that helps people who live with chronic long-term conditions understand that they're not alone at any one point, but they can also be autonomous and independent. Thank you.
Thank you. Christine, you are next. So how does success look like, and who all should be involved in this?
Yeah, thank you very much also for bringing my voice in. I am the president of International Health Literacy Association and founder of the Global Health Literacy Academy. And listening to all the presentations and thinking of our own lives, where we are often being patients or caregivers as part of also being professionals and providers, I feel we are talking about fairy tale. We want the fairy tale to have a happy ending, but sometimes we are the victims, sometimes we are the villains, and sometimes the heroes. So being victims, we can feel quite stuck in our healing journey. And as villains, we sometimes do self-sabotage because it's kind of giving up or just, let it be. It doesn't matter. And as heroes, we have the strength to move on. And I see self-care literacy and health literacy as the superpower that can actually help in that transformation, that can give us that knowledge, the competencies, the motivations to keep on going, and that can help us tap into the resources that we have at a personal level, a family level, in communities and in societies. So self-care literacy is that superpower that can change the journey to the better if we are able to use it wisely. And that brings us back to the conducive environments that has been highlighted by all the speakers. Health literacy is not a personal a responsibility on its own. We have to get that knowledge, get that motivation, get those skills from somewhere, and that comes from the conducive environments, whether it's in schools, whether it's what we learn from our family, or whether it's our professionals and providers helping and supporting us on the journey. So thank you for bringing this topic into the game. Over to you.
Yeah, thank you, Christine. Over to Judy. You talked about WHO resolution on self-care. So what do you think, what benefits would that bring in once we have this resolution?
Thanks, Hussein. So look, I think I probably answered this already, but we believe what it will do, it will lead to policy change worldwide, but especially in low and middle income countries. It will take time, that's for sure. But if self-care is not an accepted and legitimate part of national health policies, we won't move the needle at all. So we'll still have people, lots of people doing self-care, being active self-managers of their own health, and enhancing their health literacy, self-care literacy skills, but we just won't make a difference. So that's why we need all of us, and people like that we all know very well, like Catherine from FIP, like Christine from IHLA, Manjula from WHO, you, Hassan from World Patient Alliance, everyone on our coalition, United for Self-Care, because we need to join together, because we will just not move that needle if we don't do that.
Thanks, Judy. Over to Manjula. Manjula, first of all, thank you very much. We really appreciate you really reached in time for your presentation and for the webinar. Can I request you, first of all, if you talked about a lot of resources and guidelines and all of these things, if you could provide the link where we can find those so that people can access those. So that's one thing. The other one is, can you also provide us with some example or an example of an effective policy or practice in implementing the self-care interventions?
So yes, absolutely. Zain, thank you for that question. I'm happy to share the links, and these are all publicly available documents. And I know that many of our other partners also have, I'm particularly thinking of Kathy Digan and the FIP, who also have wonderful tools related to self-care. I'm happy to share those links, and just to, because of in interest of time, we do have examples of how policy has been changed and how some of these interventions have been rolled out in many countries. I'll take a recent example from India, where the Ministry of Health of India has taken on board the need to have people at primary healthcare levels access to some of these products. And so there are these self-care kits that have been made available. There's over 150,000 self-care kits that have been rolled out for free in schools, in health centers, and in primary healthcare centers. And it includes products that people can come and that can access. And I think this is maybe one way where, in there's emergency contraception, there are condoms, and there's information about where to go get better health service, or if you need specific information about a product, where they can go. So there are QR codes. It's an interesting concept about how they have managed to modify a policy and done a very targeted approach that can reach a great number of people who otherwise may not have been able to either access it or be able to afford these products. And so that's just one example, but there are several. And I think we were really surprised to see that from the publication of the guideline, which was less than 4 years ago, we have now documented over 47 countries who have changed their national policy to include self-care options. and that's for anybody who knows, the WHO process. That's actually very fast, and I think it's really because of COVID-19, where the penny, I think, may have dropped, that yes, people can actually play an active role in their healthcare, that they can self-manage, that they have a very important role within this sort of health system, very medicalized approach, that empowering those individuals and the communities, the caregivers, is a way forward. It is not the only way forward, and I think that the way we have always said is that these are additional options to facility-based care. Should people want to use it, they can, but if they want to continue within what they're more comfortable with, that should also be an option. Over.
Thank you. So over to Penny. Penny, you touched upon the patient's responsibility in self-care. Can you just maybe very briefly also, highlight, how can patients interact effectively with the healthcare providers' teams?
It depends on the healthcare provider and their sort of, time frame. A lot of times we're under the gun when it goes to how much time they can spend with us. But I think, one of the things is, as I said earlier, to be prepared for that visit, to share that information right up front about the medication you're taking, things that have changed, conditions or whatever, pains or whatever issues that have changed, that have made your condition worse, but also things that have improved. And again, taking that healthcare or that family member with you or your caregiver with you, because it's important that we get the right information, that we understand what we're being told. And most importantly is, when you're talking to any healthcare provider, if you don't understand what they're saying, ask them. It's okay. I mean, you're allowed to ask the question, and it's their responsibility to respond to you. I mean, again, you have that right to ask questions and to be treated with dignity and respect. So, a lot of times, even for, in the pain community, they say you look good. How can you be in so much pain? But that's because pain's invisible and you can't see it. But, you have to believe what the patient's telling you. Don't put them on the defense. Listen to what they're saying, and then work together as a team and ask, what can I do? But then also share what the responsibility of that patient is, and make sure they understand it when they leave, even if you have to write it out, because a lot of times we don't remember what they say. So, I mean, I know we're short on time, so I could talk forever about self-care, but.
I know. So we are already 10 minutes over, but, just last 2 minutes for question and answers to the panelists. And I would request panelists to just give you very brief answers, maybe 10 seconds answer. So starting with Christine. So you talked about, health force issues. And so in the current time with limited health force available, how can we work towards sustainable health systems?
We have to remind ourselves that we cannot take health literacy and self-care literacy for granted. That would be my advice. So we need to support and make sure that everybody is being heard.
Okay, and Christine, you talked about health literacy. So tell us about why it is so important in self-care.
So asking me again. So health literacy is important because we need to have the knowledge and the competencies to engage with the healthcare providers and internal, so that the healthcare providers are able to actually listen and fully understand and grasp the patient's life situation, as been mentioned by Penny and others.
Thank you. And Judy, why is self-care so important for the average patient? Why is so important?
Well, I think we've probably covered this already quite a lot, Hussein. And as Penny said so eloquently, she had to become an active self-manager of her health problems to cope successfully with her illness. We have good evidence about self-care now. First of all, for health systems, it saves money. It makes systems more efficient. It saves healthcare professional time. And that's great because, we know that health systems around the world aren't doing so well. But the most important thing is that we have seen now, time and time again, more and more studies and reports and the things that Manjula just talked about, as well, things FIP are doing, that it improves your health outcomes. People who become active self-managers of their health, take responsibility, become self-care literate, those people have much better health outcomes. And let's face it, that's what we all want, don't we?
Okay, thank you. Manjula, how can we prevent self-care from leading to self-harm?
Gosh, that's a difficult question. And in a short time, I think what's really important is that we need to make sure that the information that's provided to people is accurate, is adapted to what they need. We have to absolutely make sure that we are focused on equity and that we are not adding further burden on individuals, and that and we need to here, I think, be careful about sort of the consumerism approach, where there's a lot of information that's being targeted at people to say, you may need to use this, you may need to use that. And I think it's very, very important that we keep going back to the science, to the evidence, and make sure that we are providing the absolutely, as much as possible, the correct information to individuals so that they can best navigate and not self-harm, and give them the support and that safe and supportive enabling environment, which I mentioned earlier. Provide as much as possible that enabling environment for everyone. Thank you.
So Penny, very, very briefly, what can patients' organizations do in self-care? What's their role?
I think it's important for them to teach their constituents how to interact with their healthcare provider, what it means for to actually teach some of those self-management skills that are, easy to do. It's just good living skills is what it is. So I think that's really important for them to be able to teach and interact with them, to say, this is your responsibility, what it means, and how you can begin to fulfill it.
Thank you. So with this, we end this webinar. I'm extremely, extremely grateful to our speakers and panelists for your time and your enlightened presentations and input into this one. Just before we just finish, I just have two announcements to make. Next, please. This is our next webinar that's going to be on 28th of March, and it's on the deteriorating patient. When a hospital patient unexpectedly goes down, what can family do? So what can family do if a patient is in emergencies? I think it's a very important webinar related to patient safety. So it's on 28th of March. Please do register for this one. Next, please. And last but not least, this is our second World Patient Conference that's going to be held on 19th and 20th of October this year. Please mark your diaries. We want all of you to be there. And very importantly, that we are planning to have a complete session on self-care during this conference. This shows the sort of importance I think the organization gives to this topic, where your patients have to take up the responsibility and help the health systems in looking after themselves. So with this, thank you very much. I'm so grateful to all the speakers and also to all the participants for their patience listening. Thank you very much.
Thanks, everyone.
Thank you. Bye-bye.
Thank you, everyone. Bye-bye.
Bye.
Bye.